Hello, my name is Thomas Burnaby, and this is my week 14 um, remediation video. I did 85 questions on Kaplan, and I did 30 questions on New World. The first question that I'll be talking about is the nurse provides teaching to the parents of a school-age client diagnosed with hemophilia. Which statement will the nurse include in the teaching? The answer choices is joint pain should be reported to the healthcare provider. Make sure that your child takes the prescribed pills daily. Your child should drink 12 to 14 glasses daily to avoid an exacerbation, or your child will require blood transfusion regularly. Originally, I did not know what hemophilia was. But then I looked it up, and it was is when they experience bleeding into the joints and tissues. Therefore, the correct answer should have been the first joint pain should be reported to healthcare provider, because the most frequent site for bleeding is in muscles and joints, and repeated bleeding episodes can cause changes in bones and muscles, which can lead to crippling knee and joint deformities. The next question is: the nurse provides care to a client diagnosed with diabetes mellitus. As the nurse prepares to administer the client's morning dose of prescribed lispro insulin, the client adult child states, "Another nurse on the previous shift already gave my parent insulin a little while ago. Which nursing action is best?" The answer choices are: return the unused insulin to the client's medication supply drawer, document insulin administration on behalf of the client's previous nurse, contact her nurse from the previous shift, or recheck the client's serum glucose level. I do remember reading this, and I think I chose to recheck the client's serum glucose level, but I should have, if anything, I should have just done blood glucose levels, like a needle stick instead of a serum, because then you'll have to draw a lab and send it to the lab, wait for it to be processed, and then the results. So the correct answer should have been contact a nurse from the previous shift, especially because allow for confirmation that the prescribed insulin was already given, because we don't want to give it twice. Okay, and the other question is: the nurse assesses a client who is receiving a unit of PRBCs. Which finding is most concerning to the nurse? The answer choice is a temperature of 102.5, chills and nausea, or headache and increased coughing, or a temperature of 102 with a blood pressure of 92/60 and foamy oral secretions, or neck and chest itching redness. So I chose headaches and increased coughing. I thought because that's usually, well, the most common symptom for blood transfusion reactions is like pain, and I always think of like pulmonary congestion. So that's what I chose: headache and increased coughing. However, especially the coughing, because of we're considered airway and breathing, but the correct answer was the temperature of 102 with a blood pressure of 92/60 and foamy oral secretion, because these are signs and symptoms of transfusion related to acute lung injury to the trolley, and this can occur within 1 to 6 hours of the transfusion, and it can be the leading cause of death. So yeah, that is my remediation video. Thank you.